Hi, everyone, and welcome to episode 84 of the Pet Behaviour Chat. And this week, I thought we would have a chat about a topic that I have actually been dealing with quite a lot this week, and that is assessing and managing inter-cat tension. So this past week, I actually had 3 new feline cases, and all 3 of them, were multi-cat homes where we had either mild, moderate to severe inter-cat tension / inter-cat aggression. And these cases can be really quite tricky to assess in the first instance and then also to manage. So I thought I would chat you through kind of what I learned from my 3 cases, how I managed them, and just kind of go through a little bit sort of my thoughts when I look at inter-cat tension or inter-cat aggression households. Now, in my 3 cases this week, I had one home that was a 2-cat home. So there were 2 cats living together, one home that was a 4-cat home, and one home that was an 8-cat home. And obviously, the more cats you have living in the same space, the more opportunity there is for inter-cat tension, but also the more difficult it is to assess these cases. And when I say assess these cases, that often comes back to trying to sort of unpick the questionnaire and the videos that the caregiver sends me and trying to establish, what have we got going on here in terms of the social makeup or social relationships within these cats. And that can be really quite tricky. And I usually end up drawing these like big maps of all the individual cats in the home and their relationships with each other, whether they have affiliative relationships with each other, i.e. if they're friends with each other, or if there is maybe mild to moderate inter-cat tension, or if there's really severe inter-cat aggression, where maybe the cats even need to be separated, to try and map that out. And again, obviously the more cats you have, the more complex that gets and the more lines you end up drawing on your graph and the trickier it gets. And then, trying to sort of decipher those pieces of information can be quite tricky. We also want to look at timelines. When did things escalate? When did things get worse? Were the cats able to coexist in the same space for a period of time and then things got worse? Or was this an issue right from the start? Or did something change within the home that then caused things to deteriorate overall? So they can be quite difficult to assess and to kind of get a picture of. And, and oftentimes the cats will all have sort of similar names, and one will be, maybe the sibling of another, or it can be really quite convoluted to sort of pull all that apart, especially when you have, like I did this week, 8 cats in the home. So oftentimes that piece then really only comes when you start having the consultation with the client. You maybe actually see the cats, you can start to understand who they are. So for example, the 8-cat home case that I went to see this past week, we had, some of the cats that were really sort of bold and confident and curious to come and investigate when we arrived in the home. We had a few cats that were just hidden away completely. It also gives you a bit of an idea of what the current management plan looks like, who's separated where, what cats spend time together. And we can also see some of the interactions that the cats have with each other. So some of it is in the preparation, but some of it then only starts to become really clear when you actually go into the home and you actually start to see those patients. Obviously, this can also be done virtually. When I do a virtual consultation, I rely much more heavily on lots of videos and maybe floor plans and understanding those sort of routines and daily practices from the questionnaire, and actually drawing out timelines before I even go into the consultation. So that's a little bit about kind of the assessment piece. One thing I always want to really think about is I want to identify the severity of the tension or the aggression. And I want to understand whether there are sort of clear aggressor-victim relationships. So if there's one cat that is always, sort of chasing or stalking or cornering or being aggressive towards another, or such as in my 2-cat case this week, whether there might be mixed aggressor victim positions, Oftentimes there's a really clear relationship. So if, for example, in the 8-cat home that I saw, and also the 4-cat home that I saw, there was one cat, or there were perhaps 1 or 2 cats that were very clearly the frustrated ones, the aggressive ones, the aggressors that were very sort of angry and agitated about the other cats in their space. And then there were also clearly the cats that were on the receiving end of that were the more fearful, anxious ones, the ones that were actually then scared to come out because they thought they were going to be attacked by the aggressor cats. So identifying that aggressor-victim relationship, if it's there, or understanding that in some instances we can also have a mixed bag, if you like, that's an important piece. And then the identification of the severity. And I'll go on in a second a little bit more to talking about sort of covert and overt feline aggressive signals. But the intensity piece is important, or the severity piece is important, because we want to understand, if we do have a victim cat, how bad did it get? I.e., were there injuries? Were they actually sort of bitten to the point where they needed veterinary attention? Were there scratches? So in my 4-cat home case, there was one victim cat who oftentimes came away with scratches and with sort of blood. And then one of the questions I always ask is, does anybody urinate or defecate? So do the gut fights get so bad that the victim cat either pees or poops themselves? And that, again, was the case in my 4-cat home case this week. We had the little victim cat who defecated as a result of being quite severely attacked by the aggressor. So understanding that severity, because that's going to influence a little bit what we then recommend in terms of treatment, and also that separation piece that we'll come on to in a second. I think the one thing that many caregivers struggle to understand, and that even for us can sometimes be tricky to understand, is what is play, what is kind of covert aggression, so these sort of silent aggressive behaviors or postures, and then more clear normally is what are the true sort of overt aggressive events. So that's, the swatting, the biting, the fur flying, the balls of cats rolling around. I think that's a little bit clearer together maybe with vocalizations. But those overt, or sometimes we also call them passive aggressive behaviors, they can be really difficult to identify, and they can be it can be quite an eye-opener for caregivers when I say, well, actually, if your cats are staring at each other, they're already involved in a cat fight. And so some of those behaviors are staring. So that's classic, when 2 cats are kind of locked or fixed in a stare and maybe are showing body language signs of heightened emotional state. So that could be dilated pupils, ears rotated back, maybe piloerection, maybe a flicking tail, but they're essentially locked, sometimes frozen, and they're just staring at each other. So that already is the first sign of a cat fight. And sometimes it can be one cat staring at another. So it's maybe not that both cats are locked in, but it could be the aggressor cat that's maybe staring at the victim cat, for example. So those cat stares are really telling. And it's something that I always ask my caregivers to look out for going forwards, because even that already is causing this tension, or is a sign of intercat tension. So staring, sometimes stalking, so kind of walking behind or following, sometimes kind of stalking or following that the victim cat into a corner maybe, and the blocking of resources. So blocking of or displacement from resources is another really important one. So that could be maybe one cat. So let's say one cat's eating at the food bowl and another cat comes along and kind of lingers or hovers or stares at them while they're eating until they move away from the food bowl. And then the cat that was doing the staring comes in and starts to eat from that food bowl. The 4-cat case that I saw this week, what we actually had quite extensive blocking and stalking in the litter box. So the victim cat couldn't really use the litter box in peace because the other cats would immediately follow him and either attack him when he was in the litter box or prevent him from even accessing the litter box. So some of those things are, I guess, on the cusp of sort of passive and active aggressive behaviors, but the displacement from the resources is also one to really look out for. So even though there might not be obvious aggression, right? Vocalization and swatting and claws coming out and biting and fur flying and cats rolling around, there is still an element of, I guess, hostile behaviors there, even though they're not so demonstrative. But from a sort of stress point of view, or cats experiencing stress point of view, and from what's actually going on there in terms of social relationships, that's a really important piece. So really explaining to caregivers quite carefully the difference between these more passive and more active aggressive behaviors, and the fact that we already need to intervene when we have just these more passive or covert aggressive behaviors. So that's a really, really important piece, and a really nice education piece for the clients. Another thing that I chatted through quite a few times this week in my cases is what is play and what is not play. So play is usually silent. It's usually bidirectional. So one cat will go, then the other cat will go. One cat might be on its back, then the other cat will be on its back. And there's an absence of sort of emotional state, if you like. So an absence of obvious signs related to emotional state. So we don't have dilated pupils. We don't have necessarily ears rotated backwards. We don't have pilar erection. And like I say, we don't have vocalizations. So those are some of the things to look out for. I go into quite a lot of detail in my Learn to Speak cat course about that. What's the difference between play and no longer play? Because I think that can be quite important to understand. And also, it's really important to understand, when does it switch, right? When does it go from, maybe it was a playful interaction and all of a sudden it switches because maybe, you know, the one cat is just being a little bit too persistent. The other cat's kind of had enough. Sometimes grooming can also be a part of this whole thing. So we can have one cat maybe grooming the other, but it's getting a lot, and the grooming is quite intense and maybe quite fast. And then the cat receiving that grooming has had enough and wants to try and walk away. And then maybe the groomer then sort of continues that, and it might turn into a more aggressive interaction. So understanding those and observing the cats, that's why watching a lot of videos is really important. You know, getting some of the videos of these interactions, especially if the cats are living in the same space still, if they're not separated, and trying to see, you know, how much do we have of this? And then I'll often ask questions like, so how many times a day does, you know, your one cat stare at your other cat? And and oftentimes caregivers will say, oh, all the time, like they're always locked in a stare. Or, you know, frequently. And, you know, then I'll ask, how many of your cats stare at each other, or all of them stare at each other. Or we then identify the cats that are perhaps the ones showing more aggression. On the flip side, the other questions I'll ask is, who grooms each other? Because those are signs then of true affiliative behaviors, as long as that grooming behavior doesn't turn into something else. But I want to know which of the cats are friends, which of the cats can be with each other, where do we have true affiliative behaviors. And that's usually seen through, like I say, grooming each other in a nice way, especially if we're grooming each other's heads, that sort of thing. And the other thing is cats actually lying together, but lying together with at least 25% of their bodies touching each other. If they're just lying on the same bed or on the same sofa, but one cat's at one end of the sofa and the other cat's at the other end of the sofa, then that's not a truly affiliative friendship behavior. That's just a kind of mutual tolerance, and I'm tolerating you being in my space, and, you know, that's okay sort of thing behavior, unless they're staring at each other, obviously, in which case we've already got a little bit of sign of tension there. So just resting in the same place, even if they're lying on the same bed, for example, and even if they're sort of lying quite close to each other, but their bodies aren't touching, I wouldn't class that as a truly affiliative behavior. I would only think about a real friendship behavior if we've got like cats all over each other. You know how cats can sometimes kind of drape themselves over each other, or they've got, you know, paws touching, or they've got one cat's got their head resting on the other. So that sometimes also known as pillowing behavior. So that those are those truly affiliative behaviors. And that all of those things, those information pieces go into my graph or my chart or my drawing that I do. So I usually have green arrows for cats that are affiliative with each other. I usually have red arrows where we've got tension, and then I'll make those arrows thicker where we've got sort of more intensity of aggression. You can absolutely distinguish between those more passive aggressive behaviors and active aggressive behaviors. But once we start to get those things clearer, and for me, that's always by getting them down on paper and really starting to see the connections and the interactions and the relationships, that's then what helps me to understand what my treatment plan might look like. So one of the other things I ask is if we've got a breakdown in relationship between two cats, I always ask the question, have they ever been friends? Like, have they ever been friends, or have they ever been able to happily coexist with each other? Because sometimes we do have an event that fractures that relationship. Now, that could be one cat going to the veterinary clinic, for example, coming back and all of a sudden smelling different. And then we've got a breakdown in relationship. And because cats aren't very good at repairing breakdowns in relationship, then that might be something that escalates into something more permanent. I've also had a couple of cases. I had one case where we had two sibling cats, two sister cats, who previously were really closely bonded to the point where they would pillow and they would groom each other. And an event happened in the home whereby a glass vase fell somehow and crashed to the floor. And there was glass everywhere. There was a lot of noise. And the two cats happened to be in the same space together. And that event broke their relationship. And that I've seen that a couple of times where something external in the environment, something happens where both cats get a massive fright. They happen to be in the same vicinity, and it just breaks their relationship. Why it breaks their relationship, we probably don't know for sure, but it's because both cats are experiencing, I think, heightened emotional state, fear, anxiety, panic a little bit, and they're associating that with the presence of the other. So I think that's likely what it is, but I've definitely seen that happen before. Redirected aggression is another one. So let's say, for example, you've got two indoor cats that are quite happily living with each other, and all of a sudden an outdoor cat, a neighborhood cat, comes into the garden, and one of the cats or both of the cats can see that alien cat outside through the window. And then their emotions bubble up and bubble over. They get, again, fearful, anxious, frustrated usually. And then they kind of take that out on each other, or one cat takes it out on the other cat. And that can then also lead to a break in relationship. And that redirected aggression piece, I think we also have to be really careful as people. So if we do have two cats engaged in a fight, we want to try not to intervene, because it's really dangerous that one cat could, in its very heightened emotional state, redirect their aggression onto us as people, and they can cause pretty intense injuries. So that redirected aggression piece is also something that we always want to be mindful of. And why do I ask this question? So have they ever been able to have a good relationship? Well, that's because it might, and I'm going to say might in really sort of strong italic and inverted commas, it might be that if they have had a prior good relationship, it might be that they can get back to that. Whereas if we've had one cat that's been in the home for a long time, and then a second cat comes into the home, and right from the start, we have severe agonistic behaviors and severe sort of, tension and heightened emotional arousal, hissing and vocalization and all that sort of thing right from the start. And then maybe we don't have a slow introduction process, but rather the introduction process is quite fast. And then the cats, from the beginning have quite a hostile relationship with each other. That might be more difficult to treat. And again, I say might, because nothing is ever absolute, but it gives me a little bit of an indication of, hey, these cats have been friends previously. I wonder whether that might be a better prognostic indicator than two cats that have from the beginning been quite hostile with each other. And then my next piece of information that I want to gather is, can these cats, even if there is tension there, can they still somehow coexist in the same space? And that often has to do with a lot of things. So it has to do with the amount of space that's available. So is there enough room for the cats to avoid each other? Can they just kind of disperse from each other? And, one cat kind of spends most of their time upstairs and the other cat spends most of their time downstairs. And the tension really only arises maybe at feeding time or when the people come home. And then both cats are motivated to sort of be in the same space. And that's then when the tension arises. But the rest of the time, they actually choose to be far away from each other. And that is sometimes the case. So in pretty much all of my cases this week, we have had plenty of space, which has been great. Apart from the 8-cat home, I'm going to say, but there was something else in that home that actually made things not quite so bad. But certainly in my 2-cat home and my 4-cat home, there was plenty of space, which is always great because we can then talk about, creating zones maybe for cats, or the cats just naturally having the opportunity to at least spend large parts of the day away from each other. So that's something that is always a good kind of prognostic indicator in terms of being able to keep all cats in the home and being able to manage them. The other thing is resources, and that was the case in my 8-cat home. So even though we had 8 cats in not a huge home, the caregiver had done an amazing job with existing resources. So that's litter trays, feeding stations, water stations, hidey places to get away from each other, outside space that was sort of a kind of a big catio, but where some of the cats could disperse to. The feeding regimes were really well thought out. There was a lot of thought that had gone into resources. And that meant that at least 5 of the cats could sort of coexist with each other. The 3 other cats were still separated, but plenty of space and plenty of resources is usually the reason why we might have cats that are able to coexist in the same space. Now, if cats aren't able to coexist in the same space, and what does that even mean? It means that as soon as one cat just catches a glimpse of the other or even just smells the other, we have a severe aggressive event. So let's say, and this, will oftentimes happen if cats are separated and the one cat manages to escape, if there's a management fail, for example, and then they immediately hunt out the victim cat or the other cat, and they immediately stalk them, chase them, pounce on them, and engage in a physical fight. And many of my cases are just like that, where cats, even by the time I arrive at the consultation, the cats have already been separated for a little while, either because there was a severe fight that did cause injury, or one of the cats to urinate or defecate, and the owners just weren't able to manage that, or that literally every time one cat sees another, there's a high likelihood for a really bad fight happening again. So those cases where the cats are already separated and where the intensity of the aggression is so high, those are usually the ones that are more difficult to manage. So where we have space, where we have resources, where the cats can kind of coexist in the same space, we might have more opportunity with our treatment plan to actually create an environment that the cats can all stay in the same home, and and we can create a situation that preserves everyone's quality of life and that minimizes aggressive events and tension. Where it gets trickier is if we have permanent separation, and even with the permanent separation, there's still high emotional state. So maybe let's say one cat is separated into the room and the other cat is constantly sitting outside the door of that room or trying to paw underneath it. Or let's say the cat that is maybe separated away gets really frustrated at that separation, and then there's lots of vocalization there. And then the cat, that's not separated responds to that vocalization by sitting outside the door. So even through the door, you can get aggression happening even through the door. So those cases, in my experience, are notoriously more difficult to manage. So I want to get a really good understanding of that. Like, can these cats coexist in the same space, at least for part of the day? Or do we have a situation where literally as soon as they either catch sight or smell of each other, things go badly wrong, or there's this hyperfixation on the barrier that is creating the separation between the cats, whether that's a door or a screen, or so a non-transparent screen, or whatever it might be. We've got both cats really hypervigilant, or one cat very hypervigilant because they know that other cat is just behind that barrier. So those are some of the things that I want to ask about. And then the other thing that I also want to understand is how is everyone being affected? So let's say we do have a multi-cat home, but maybe we've only got 1, 2, or 3 cats sort of engaged, I guess, or involved in the sort of truly severe aggressive events. That is still going to have an impact on the other cats. So the other cats are still going to be there in that space, witnessing those interactions, understanding that we've got a heightened emotional state. And oftentimes, other cats will get involved or will be affected by some of this severe sort of aggression that can occur. So I always want to understand, how is it affecting everyone in the home? And by that, I would also include the caregivers, because living in a situation like this can be really difficult and highly stressful for the caregivers. They're always on the lookout of making sure the cats stay separated, there's not a management fail and a door gets opened by mistake, or they're rotating cats, and that can be really stressful. They feel guilty oftentimes because maybe the separated cat doesn't receive quite as much of their attention, or they feel the cat that's separated away has a lot less space, maybe if they're separated into a room. So it affects everybody, and I want to build that into my treatment plan. So if I think everyone's affected or all of the cats are affected, then definitely we want to have some elements in our treatment plan that address the health of all of the cats. So that might be through a diet, like a calm diet. That might be through pheromones in the entire home. That might be by giving everybody some calming supplements, and then focusing our psychopharmacology on the cats that are actually involved in the severe aggressive events. So that's the other thing I look at. And then one of the things that I often see going wrong in these cases is that caregivers, by trying to do the right thing, they inadvertently do the wrong thing. And that is doing every day some kind of a visual introduction, right? So let's say we've got 2 cats separated that are really not happy with each other, but every day the door gets opened a crack and the cats are able to see each other, and immediately when they see each other they start vocalizing or swatting, or we have a bad situation. But the owners think that by letting them see each other a little bit every day, they're actually going to help the situation. So I guess they're almost thinking that they're doing a systematic desensitization. But the problem is that these cats are so highly aroused and their emotional state is such that every time they see each other, it actually just makes things worse. So that's often one of the first things that I'll say is, no more letting them see each other. And then also caregivers try and like feed the cats up each side of the door, or they leave the door open a crack and, feed the cats either side of the door. And in cats, that's also not something that's very helpful, because of the fact that cats are a non-obligate social species and they're not social eaters. They eat in isolation. So feeding them next to each other is going to probably just cause conflict, because they want the food, but then they're also still in conflict with the other cats there. And that creates this really sort of conflicted emotional state. And again, probably just makes things worse. So those are some sort of quick wins and easy things to recommend to start off with, as well as sometimes recommending permanent separation, maybe without rotating the cats, and just getting them to a place where all the cats are able to feel safe, and where we don't have this sort of constant like visual introduction, or cats being able to see each other that are actually really not in a good spot with each other. So one thing, or one paper that I just wanted to mention here, is a paper that came out last year, and that is the AAFP Intercat Tension Guidelines. And this is from JFMS, and I feel this is such a valuable resource. And I'll often glance over it. So this week I had it out like all the time, because I knew I had like 3 intercat aggression cases. So I just glanced through that a few times, and I love it, because right at the back there are these amazing flow charts that really sort of remind me, or talk you through again, what do we need to do if there's intercat tension? Do we need to separate the cats or not? And if the cats do need to be separated during treatment, when do we want to do our follow-up? And then if during the follow-up the cats still can't be introduced to each other, or still need to be separated, then comes the moment where we think, well, is this going to be successful at all? And I've had so many cases where the caregivers have been adamant that they've wanted to keep both cats in the home, or, all of the cats in the home. And we've gone through a treatment protocol with psychopharmaceutical medications, behavior modification, really gradual reintroductions, and we still haven't had a positive outcome at the end. And that's something I think that is really, really important to warn caregivers of, is that even if we do everything, and even if they do everything right, it might just be in that cat's nature, or in those cats' natures, that they can't tolerate living in the same space with another cat. And that's then when we start to talk about other solutions. And for me, where I have two cats that are highly, highly aroused, permanently need to be separated, where there's been a high intensity of fights, that's oftentimes the conversation I'll have even before I suggest we can use medication, or, we can do gradual reintroduction. Because in some instances, it is actually just easier to come up with a management plan. And in many instances, it's actually been a relief to the caregiver to actually say, oh, okay, well, actually, this particular cat can go and live with a family member, or, my son or daughter's already said they'd love to take that cat if it doesn't work out. And there might be quite not easy, maybe is the wrong word, but maybe a more simple solution to managing this whole scenario. And sometimes also from a welfare point of view, it can be better to actually just remove one of the cats from the situation, or a few cats from the situation, or find other options. It can be better from a welfare perspective than trying to make something work that is going to be really stressful for everyone involved, all the cats and the caregivers as well. Now, obviously, that is never a popular conversation, and a lot of caregivers feel really sad or frustrated or a bit despondent when I say this. And then we might, decide to initiate a treatment plan. And I've also had many instances where the caregivers have actually realized themselves after a period of time that, hang on a second, this is probably not going to work, and we probably do need to look for a plan B. And at the end of the day, every single caregiver I've ever worked with has only ever wanted the best for their pets. So understanding that actually the quality of life, the welfare, and the sort of the emotional state that they're experiencing is maybe not the best thing for them. And it might just take them a little bit of time to come around to the thought of finding a different solution for one of their cats, perhaps. And then I also, just the final thing I want to touch on, I also oftentimes have the conversation with them around psychopharmacology. Now, if the cats are to stay in the same home, and if there's really lots of heightened emotional arousal on the parts of numerous cats, then I think, all of them likely need psychopharmacology or would benefit from psychopharmacology. And then we have that whole conversation around, well, do we want to medicate these cats when actually, by maybe rehoming one of them or finding a different solution for one of them, would solve the problem and would negate the need for psychopharmacology? So that's sometimes also a conversation that I have. And sometimes the cats need psychopharmacology regardless of whether one cat's being rehomed or not. It's possibly that one cat is behaviorally abnormal and has high levels of arousal, and maybe also human directed aggression, and maybe also then we've got feline house soiling issues coming in. And even if one cat is removed from the situation, maybe the cat that remains could still benefit from psychopharmacology, and that absolutely is something that I would 100% assess. Or maybe they're showing compulsive behaviors. Oftentimes you'll get a whole host of other behaviors coming into the mix when you have this intercat tension or intercat aggression. So there may absolutely still be justification for using psychopharmacology, even if one of the cats is removed from the home, for example. But sometimes when really the only reason that we would be using psychopharmacology is to facilitate a reintegration of the cats, and actually that could be managed really well. If there were another solution for one of the cats, perhaps, then that is a conversation that I'll have. So that was my kind of lowdown on what I think about when I am seeing multi-cat homes. These are not easy cases. They are pretty full on, and it does take a moment until you kind of get your head around all the individual cats and their individual temperaments and their personalities and how everything is set up and what the sometimes very complex routines are that the caregivers have to try and keep everyone safe, and then the space, and then the resources, and then, you know, the cats are always some family member's favorite cat. So when you do have those conversations about maybe finding other solutions, then that can cause conflict within the family because, no, I want Fluffy to stay, but no, I want Misty to stay in because, you know, Misty was my favorite. So anyway, it can get quite complex. But I love these cases. I actually, it's the complexity that I love about it. And I wrote it in one of my social media posts this week. Actually, one of my favorite things is when I can start to see the picture clearly. And sometimes I go and I think, oh my God, I've got absolutely no idea what's going on. You know, I've drawn all my pictures, I've drawn all my graphs, and I go in and I'm still a little bit like, I don't know exactly, you know, if I'm going to fully grasp these relationships. However, it's like the picture just becomes clear. The more you see the cats, the more you speak with the caregivers, the more time you spend in the home. And all of a sudden, the picture just becomes clear. And I'll have a moment of, yeah, I know exactly what I think I want to do, or I know exactly what conversation I need to have with the caregiver. But yeah, it takes a bit of time, and it also takes a bit of practice and experience. I see a lot of intercat aggression cases in the UAE. I mean, like I say, 3 cases just last week, and, you know, more to come. So, and that's what my regular sort of feline caseload looks like. So yeah, they're complex, but they're also extremely satisfying, because I think they're one of those cases where you can really make a massive difference to the welfare and the quality of life of everybody, but especially the cats that are involved in those more severe aggressive events. All right. I hope you found that useful, and I will see you next week for episode 85. Bye for now.